All right, it is noon, so let's go ahead and get started here. We have a great session planned for you all. We'll be doing a seeker showcase with recently released product features. And we have our VP of Product, Jack Kelly, on the line today, who will be sharing some insight from his perspective. So with that, we can go ahead and get started. Just a quick introduction. My name is Lauren. I'm on the careviso marketing team, and I'll start out by doing an introduction to careviso and introducing our platform seeQer. Then I'll pass the mic over to Jack Kelly, who will be doing a session on seeker updates, so what we've been adding and what we have available, as well as some future features. And that's what we have upcoming and some features that we have in the seeker pipeline. We will then move into a live Q&A session. We will have Jack here to answer any questions about the content that we'll be presenting today. You can use the Q&A function to submit your questions. You can submit them at any point during the webinar, but we'll just be answering them at that later section today. And then we'll round out with a short closing, as well as some contact information if you have anything that comes up after the fact. We always love to get any questions or comments following the webinar. So with that, we can go ahead and get started and talk a little bit about careviso and who we are. So we began with a focus on diagnostic testing patient access. We were founded in 2017, and really the catalyst to our founding was when payers began requiring physicians to perform prior auths for molecular diagnostic testing. Since then, we now have 78% of all OBGYN physicians in the US as part of our network, as well as 30% of all oncologists in the US in our network as well. As a whole, we have over 300,000 enrolled physicians. So while OBGYN and oncology are kind of our main specialties, we also work with physicians across all different specialties, totaling up to over 300,000 physicians in the United States. We perform 1 million prior authorizations annually, as well as 150,000 price transparency transactions each month. This final point on the slide, which Jack will really be honing in on during his section, is that we're continuously optimizing our technology platform. That's something that we really prioritize so that we can have the most comprehensive platform, as well as giving you the most up-to-date and accurate information that we can. A little bit about seeQer and our platform. So we refer to seeQer as the single platform for patient access across healthcare. We have created the complete platform to simplify the process for patient access and reimbursement all in real time. With seeQer, you can reap a number of benefits because the platform tells you the cost of CPT-J codes, network status, member benefits, member cost responsibility, PA requirements, medical policy, and the likelihood of coverage. Now, with the seeker process, we've kind of broken it out into 3 separate points that you'll see on the right side of this slide. The first being benefits. So a facility or a careviso customer would send all cases to us, and we would determine member health insurance benefits. Number 2, the pricing and coverage piece. seeker would then run through our proprietary databases to determine the cost and coverage of a procedure or test. And lastly, the prior authorization. So when a prior authorization is required for a product or test, seeker can then reflex automatically. So not only can seeker tell you if a prior authorization is required, we can then also set it up so that we can process the prior authorization on your behalf so that you can take away that administrative part from your team. Talking a little bit about our seeker platform design. So when we first created the platform, we had the idea of wanting to answer a number of questions. While healthcare is, as we all know, very complex and a lot of the processes are out of date, we wanted to figure out a way in which information could be communicated easily and at your fingertips. So some example questions that we wanted to answer when creating seeker was, what is the provider's network status? What is the price of the healthcare code? And for that specific one, how we answer that is based on current healthcare coding methods, such as CPT codes, HCPCS, J codes, and ICD-10 codes, so that you can have the most up-to-date and accurate information. Some other questions: is the procedure covered? Is a prior authorization required? And what is the patient out-of-pocket cost? And in Jack's section, he'll really go into more detail exactly how we're answering these questions and some of the updates we made so that we can answer these. So with that, I will kick it over to Jack Kelly, our VP of Product.
Perfect. Thank you, Lauren. Hello, everybody. I'm Jack Kelly. I've worked at careviso for over 6 years now. I started out in account management, moved into clinical operations, and I helped develop and continuously improve seeQer over the years, which ended me up in the product role I'm currently in. So seeQer has a lot of different data points that go into it, and we've created a lot of our own databases in order to deliver the product our customers see necessary. So I'm going to go through a few of them and just call out the differences. So our first one is our NPI database. This contains network status by health plan by product for all NPIs. So for labs, we obviously have labs provide us the network status, but we've also built out a network status database for all of the providers in the US. And this is continuously growing. In this way, seeQer can identify the network status of that ordering provider as well. We also have pricing databases combined with our machine readable files as well as provided pricing. This pricing gets down to a PPO, HMO, POS plan type level, along with figuring out if it's the in-network providing the in-network pricing versus out-of-network pricing or non-covered pricing, as well as list pricing and cash pay pricing. It's really a big pricing database to make sure we give the patient as accurate a price to the claim as possible. After that, we've developed our coverage database. This comes from a couple different fields, and I'll dive in deeper, but there's generally non-covered codes. There's also ICD-10 code and CPT code combinations that mark things as non-covered. And we've built out this database to go code by code and provide those coverages there. We have a prior authorization database. This prior auth database is based on CPT code and payer, and sometimes plan type, and sometimes provider where necessary. It's continuously improving because we do submit prior authorizations, so we take those and add to them. But we also do monthly refreshes from the data scraping we do, the research we do, the PDF OCRing we do. So it comes from a lot of different sources to build these databases. We have a medical policy database that displays the medical policy where needed. And then lastly, the proprietary algorithm of you take all of these 5 databases and you have to combine them into an equation along with the patient's estimates. So there's a lot going on there, but it all happens behind the scenes. But we wanted to kind of show where we were pulling all these from. And then now we'll go into the newer iterations of our product here. So one of the biggest asks we got was an insurance discovery product. We definitely took our time making sure we picked the correct one. We were focused on the accuracy rate as well as having as close to real-time discovery as possible. We got the question when we were doing seeQer, well, the 10% of inactive patients we had, what do I do with those? So we built in the ability for seeQer to identify when the patient's active coverage is not found. We can clone that case and attempt our insurance discovery process. This starts instantly after that inactive coverage is found. With that, we're taking the geographical data that we were provided as well as the patient information that you think is correct. And usually this comes back with an incorrect member ID that we fix, new insurance coverage altogether, or correcting the patient name or date of birth. And we are at about a 30 to 40% success rate on what we call the worst cases possible that come through our system, and we couldn't find active coverage the first time. So we have also developed a few different coverage features in the past couple months. The first one was building coverage down to a plan and ICD-10 code level. We started this because we had a database of non-covered codes, but there was a need to understand if this patient has this diagnosis and this code, is it going to be covered or not? So this is based on medical policy research, and seeQer can state if the code is non-covered, covered, or unknown. And then based on that coverage, the patient will not owe the price of that code, or the patient will owe the total cost of the code, and it won't be applied to their benefits. These configurations are on a payer-by-payer basis. For some of our drug codes, we have this database built in. For our lab codes, we are continuously building this. And if you do start and want your specific coverages loaded in, we can also do that to get a fuller database. So also along with coverage, we built in something we call covered at 100%. This is really for things like screening testing, where we know the patient does not owe anything. So for certain procedures or tests, the insurance does not require the patient to pay an out-of-pocket. We can have that configured, and our equation will update this as well. So this is something with a lot of lab screening tests that we've seen, and just wanted to make sure we covered that ask for everybody. Also, I think I might present this slide every time we have updates, because benefit pool complexity never stops. We are doing, the 270, 271, and it can be pretty simple at first, but as you dive into it and you see how you can use that to get closer to the claim and more accurate data, we've seen big improvements here. We have payer mapping and a database that basically for each payer, how you pull the benefits versus how they're billed on the claim. Some go to the primary care, some go to the lab benefits, some go to the surgical benefits, whatever it is, we have mapped in to make sure we pull those correct benefits. We also have the logic on a payer by payer basis for family versus individual. You would hope this would be the same across every payer, but it can differ a little bit. So we built in those exceptions here. We've also seen certain limitations placed on Medicare Advantage procedures, such as limitations on coinsurances that are kind of at 20% no matter what the 270, 271 says. So we've built those in as well, just to get more and more accurate. And this is continuously improving. We kind of build these tables out so that we can catch all of the outliers that we find as we review claims data. So in the API, we've added a few additional fields lately, and we kind of continuously add them where we see needed. We have the effective date in there. We had the coverage updated based on all of our coverage logic. We have a CPT code cost in there now. We have a verified plan type. So this could be PPO, HMO, Medicare, just to give you more detail in there, as well as the funding type. So if it's self-insured or fully insured. And so these are all the recent requests we've had, but we will continue to add more features as we see fit from data from our own internal databases or from the 270, 271. Another kind of feature we've had for a while, but has been improved, is our out-of-network benefits, or using the cash pay price in these situations. So based on the benefit pools, we have identified easily and accurately of when a patient does not have out-of-network benefits. And so in these situations, we can display a warning message to a patient to show them that they have no out-of-network benefits and they've chosen an out-of-network provider. We can also, based on configurations, show a cash pay price or a list price or whichever price needs to be shown there in that spot, as well as that warning of no out-of-network benefits. So you're going to owe this higher price here. So we want to call it out and make sure patients don't get that surprise bill because they chose an out-of-network provider. So going into the future, we have a few different products, and we're going to continuously add on to them. We've got this ask recently, which is some providers have a maximum test price that they bill. So seeQer will be able to limit the patient test price on a test by test basis so that we do not go above that test price when providing a bill to the patient. It'll also be more accurate to the claim. Along with that, while you're calculating the max test price on some of these panel codes, the insurance companies want the codes ranked in how you will bill them. And so you don't bill certain codes, or certain codes are billed at a lower price. And so we built in this ability to rank the codes, and we'll be releasing this in the new year as well. Along with that, I think the biggest thing we're focusing going into the new year is how to get even more and more accurate. seeQer continuously improves day in and day out. I think I've enjoyed personally through the painstaking of looking through benefits, but you can really find different trends and different results in these benefit pools that you see how the payers do them slightly different. And this really comes with a combination of a claims data analysis to get more accurate, understanding how benefits are pooled versus how how the claim is actually billed is the biggest thing, and making sure those both match. We also are going to continue our PA database. We are getting it down to a Medicare, Medicaid, and commercial level, because we're seeing that split on the payers when they publish their lookup tools or their PDFs of how PAs are required. And we combine our monthly refresh of these lookup tools and these PDFs with our self-reporting from when we submit PAs and are getting documented clean claims not required, making sure we update the PA database along with that. And then lastly, we are just making sure we update payer mappings so that we can provide back the accurate description of the payer's plan, and making sure that we pull those correct benefits based on the plan type, not just the payer name.
Great. Well, I think that was your last slide, Jack. Thank you so much for presenting all that great information. Now we have a chance, if anyone has any questions that they'd like to submit to Jack on any of the information he just presented, or in general, you can use the Q&A function on this webinar and we can answer them. On the next slide, also, we'll be providing some contact information if you think of any questions after the fact. But for now, feel free to submit any questions. And I'll just give a minute for people to type. Oops, sorry. Okay, we did get a question. So can careviso/seeQer determine if the payer listed is the patient's primary and/or secondary insurance when entering a patient's insurance information to verify eligibility?
That is a wonderful question. So we have found a piece of technology that can do this, and this is on the later in 2025 roadmap to do. We will be able to take either one insurance or both insurances in and be able to determine which is the primary and secondary. It's definitely a little complicated, but we wanted to make sure we could do it in real time. And we are finishing up kind of utilizing this vendor and making sure they can cover the whole scope of the payer landscape before rolling it out to any customers. But we do plan on doing this.
Awesome. Yeah, thank you for submitting questions. Yeah, any others, feel free to put in the Q&A. We'll give another minute if anyone has any others. Okay, let's see. Is PA submission available on the portal? If yes, are there specific payers?
Yeah, so for laboratory testing right now, we submit PAs for all payers. For outside of lab testing, we are in the process of piloting some of this to process prior authorizations outside of lab testing. If you have any specific use cases that you are wanting prior auth on, reach out to your sales rep or your account manager, and we can figure out kind of if they fit in the current scope, if they're in the future scope. And then if they are lab PAs, I would say 99.9% of payers we can submit to. Great question.
Yeah, thanks again for submitting your questions. We'll give one more minute if there's any others, then we can move on. We have one. Why is network status included in seeker?
Yeah. So it's included for a few different reasons. Um, the first one is when you are pulling benefits, there's different benefits for in and out of network. When you're pulling pricing, there's different pricing for in and out of network. Even when you're pulling PA requirements, there's different PA requirements sometimes for in and out of network payers. And so we built all of that level into seeker to be able to be configured one way or other based on the provider's network status. And that's kind of one of the key things we start with is that network status there.
Great. All right. Um, yeah, if there's no other questions at this time, thank you for those who submitted questions. We can move into the next slide where we'll provide some contact information if you think of anything once we end the session. So thank you again for submitting questions. All right, so for everyone on today's call, thank you so much for being here. Again, if you have further questions about seeker, you can contact us at info@careviso.com. If you're also interested in booking a demo, even if you're a current client, just to kind of see more about the features that we're coming out with or have come out with, you can visit www.careviso.com/contact and you can fill out a request form or feel free to talk to your account manager. They'd be more than happy to run you through anything new that we've come out with. So once again, thank you all for being here. Thanks so much, Jack, for being on, and have a great rest of your day.
Thank you all.
Thank you.